Las Ceann Comhairle, I welcome this opportunity to update the House on Ireland's ongoing response to COVID-19. Las Ceann Comhairle, I'd like to start by expressing my deepest sympathies to the families and to the friends of all those who've lost their lives to COVID-19 in Ireland. It's a loss that we know has been made much harder because of the limits that COVID-19 has put on our lives. Families looking through the windows of nursing homes to try and communicate with their loved ones. Lifelong friends not able to walk to the graveside to bid farewell. It's been a difficult year for so many people in so many different ways. For those who've lost their jobs, for those who've lost businesses that they've spent their entire lives growing. For those most vulnerable to the virus, for those who've had to shut themselves off from their friends, from their families, from their communities for very long periods of time. For those who have lived in fear since this virus arrived on our shores. Chapter 1 of COVID for Ireland was flattening the curve. It meant accepting severe restrictions on our civil liberties and on our economic freedoms in order to stop transmission of the virus. And thanks to the sacrifices and the solidarity of everyone in this country, it worked. As Minister for Health, I want to acknowledge the extraordinary work of the women and men across our health service and all they've done to date in response to this virus. But we don't want to go there again. Chapter 2 of dealing with COVID for Ireland, which is what we're at the start of now, is about suppressing the virus in order to keep our society open, in order to keep our economy open, in order to protect our civil liberties, our economic freedoms, in order to protect the ability of people to go about living their lives. And we've learned a lot about this virus since it came here in March. We can find the virus more quickly, thanks to our testing and tracing capability, including the COVID Tracker app. We can send in local public health teams more quickly. We can help people isolate more quickly and better. We know more about the kinds of interactions that are spreading the virus. And it's these types of interactions that NPHET, the National Public Health Emergency Team, targets when it recommends new measures. What happened in Kildare, Laois and Offaly demonstrated that local measures applied quickly, targeting the ways in which we know the virus spreads and supported by local communities can work. And thanks to the people in those counties, can work very fast. A new roadmap for Chapter 2 will be published on Tuesday. It will apply what we've learned about this virus to help us find the virus quickly when it is spreading, suppress the virus quickly, and protect our priorities: people's health, people's lives, keeping our schools open, our colleges open, getting our healthcare systems resuming as much as possible, protecting jobs. This month marked a huge achievement across Ireland as the schools returned. At the same time, we're seeing a huge level of compliance with the public health measures. New research shows, for example, a 90% compliance with face coverings. And for younger people, a group who I believe have been very unfairly criticised by some, who I think are doing an incredible job, they show the highest level of compliance at 97%, and I applaud their efforts and their ongoing efforts. And if we're to continue with this kind of success, people need to be confident in the public health measures. They need to be confident in the recommendations coming from the public health experts. They need to be confident in the measures that they see in the roadmap. They need to be confident in the measures that are in place now and that are working now. And I'd like to thank the many deputies in this Dáil for their support with our public health measures their support of our public health experts and the recommendations coming from those experts. I spoke some weeks back with the World Health Organization. We were talking about Ireland's response and what we could do better, what we should do more of, what we might change. And one thing they pointed out, where they had said Ireland stands out, was political solidarity. They observed that in some countries, COVID was being used as a political football and political systems were tearing themselves apart. And they said Ireland wasn't unique, but was rare in a level of political solidarity and a message that had gone out from our Parliament saying we stand with this approach, we back a public health-led approach, we back an evidence-based approach. And while there would always be differences, the politicians were clearly seen to be working together. And the WHO's view is that this mattered, that it mattered a great deal to public confidence. And Las Ciancórla, leadership from government matters, obviously. Fully accept that, and we must always strive to do as well as we can. And we must always be open to criticisms and fair criticisms. Can I say as well that leadership from the Oireachtas matters? And while I really applaud the work of many deputies here, I would suggest we're not doing as well as we were. I would suggest that maybe the WHO might score us a little less. Now, earlier today, in a previous debate on public health measures, I listened to some deputies in this House decry measures that they know are saving lives. I listened to it. I listened to some deputies stand up and say they couldn't possibly understand why one particular measure was in place while another wasn't, while knowing very well why those measures were in place, because they had been provided with the public health advice as to why. And I would just like to ask my colleagues in here to reflect. We're not looking for free passes. There should be no free passes. But the more solidarity we can show, the more confidence there will be in the public health measures, the more lives will be saved, the more jobs will be saved, and the more people can live their lives, which I know is what we all want. Las Ciancórla, I'd like to move on to the current COVID situation. So around the world, the WHO has now reported 27 million cases and nearly 900,000 deaths. Yesterday in Ireland, we passed 30,000 cases, and we have tragically now recorded 1,778 deaths from COVID-19. In the past 2 weeks, for every 100,000 people living in Ireland, we've had 35 new cases. It's worth remembering that in early July, it was just 3. So we've moved from 3 cases per 100,000 to 35 cases per 100,000, more than a tenfold increase. We're not at the levels that we saw in April and May of this year, but we are on an upward trajectory, and it is a cause for concern. It is important, however, to point out that the national measures which were introduced recently are working. They, first of all, slowed the upward trajectory, and they then began to stabilise it. And I want to acknowledge that is having a big stabilising effect, and that the efforts being made across the country right now, and the sacrifices being made across the country right now, are doing what they were intended to do. This rise is being seen across the EU. Most other member states are experiencing an increase in the number of cases in recent weeks. Across the EU now, the incident rate is 55 cases per 100,000. There are 16 members of a higher rate now than they did 2 weeks ago. So it's rising. In the past fortnight, in Ireland, we've been notified of 1,900 new cases and tragically 1 death, which was reported yesterday. The number of cases newly notified to us has been increasing over the past several weeks, and the 5-day average, which is looked at very closely, is now 175 cases per day on average over the last 5 days. In the past 2 weeks, more than 50% of new cases identified have been close contacts of a confirmed case. Just under 40% of cases in the last 2 weeks have been linked with clusters. There were 145 additional new clusters notified in the past week to Saturday, the 5th of September. there's been an increase in the number of clusters identified around the country, with smaller numbers of cases associated, such as those in private households. 70% of cases identified in the past 2 weeks have been in the cohort under 45 years of age. And at the moment, Lasceann Comhairle, there are 50 people with confirmed COVID-19 cases in hospital, and 6 of these are in critical care, and our thoughts are very much with them and their families right now. Now, thankfully, we are much lower than the levels we saw earlier on in this year, and it is our hope to keep those numbers low, and it's exactly what the measures have been introduced to do. The National Public Health Emergency Team will meet on Thursday and will review the current restrictions based on the most up-to-date epidemiological position, and will advise government accordingly. In the past week, nearly 72,000 tests have been completed. Serial testing continues in nursing homes, in direct provision centres, in meat processing plants. Significant additional staff have been added in the past 4 weeks, and the HSE is currently moving from a seconded staff model to a full-time staffing model. The vast majority of Irish people are united in our fight against this virus, and I know the House will join me in thanking every person and every sector for their hard work. There's no question but that it can be tiring continuing to live with the impacts of COVID-19. We've been dealing with it for quite some time. We're going to be dealing with it for quite some time more. And unfortunately, the virus doesn't get tired. We need to hold firm. The core advice from our public health doctors remains the same. Wash your hands, follow coughing and sneezing etiquette, obey social distancing, reduce discretionary social interactions. Any and all public health measures introduced are intended to save lives and to prevent more people from getting seriously ill. By continuing to suppress community transmission, we will be able to continue reopening vital parts of our economy and society. The government's new roadmap will inform our decisions going forward, and it will be a key source of information for everyone in Ireland as we continue to navigate life during this pandemic. Thank you.